anyone who is not immune to a measles can get the infection. So while anyone who doesn't have immunity is at risk, what we do see is that there are certain populations that are at higher risk for complications. And so that would include children under 5, pregnant women, people with weakened immune systems, and sometimes older adults. Vitamin A does not prevent or cure measles. The misperception comes from the fact that if a child has a measles infection, if that child is vitamin A deficient, they would be at risk for some worse outcomes. And that's particularly in resource-limited settings. In the United States, very few children are vitamin A deficient. But if your child gets measles, your pediatrician might recommend vitamin A as part of supportive management. I do caution, though, parents should be careful trying to give vitamin A on their own because it's easy to overdose, and vitamin A toxicity can be quite severe. Measles is extremely contagious, so it's easy to catch. Measles is spread through the air, and so it can linger in a room, which means you can get measles just by being in the same room as someone else who's infected, even if they left a couple of hours ago. So the best prevention against measles is the MMR vaccine. 2 doses of this vaccine is up to 97% effective at protecting your child. So it's far and away the most effective way to protect children against measles. Measles used to be under control in the United States, but we are seeing some outbreaks in communities that have reduced vaccine rates. So as more people are susceptible to it, we're seeing outbreaks occur. Avoiding the infection can be very difficult if it's spreading in your community because it's so contagious. So we would encourage parents that the MMR vaccine is far and away the best way to protect your children. Dozens of high-quality studies all across the world have evaluated a potential link between MMR vaccine and autism. Millions of children have been evaluated, and the data are very clear. The MMR vaccine is not associated with autism or developmental delay in any way. Measles is a vaccine-preventable disease, but before routine immunization was available, measles was a very common childhood infection in the United States. Millions of children would get it per year. Thankfully, most of those children did well and didn't have any long-term complications, but that's not the case for all of them. Measles can have some very severe complications, including pneumonia, encephalitis, and even death. Prior to the prevention of measles through routine vaccination, thousands of children in the United States were hospitalized per year with measles infections. Many of them did have some chronic disability that went with that, and up to around 500 kids per year died from measles. So if that's something that we can prevent through routine immunization, we want to encourage that.